Hi everyone, just to introduce ourselves, my name's Nikki. I'm an exercise instructor, health and wellbeing advisor and smoke stop advisor, and this is Colin.
I'm the physical health lead, and I am a smoke stop advisor, physical health lead for Dorset, for the rehabilitation services.
So we work for Dorset Healthcare and we work within an inpatient mental health rehabilitation service. We work on a locked unit. Can everybody see this, by the way? Yep, great. So, our local background, our trust announced that we were going to go smoke-free by April 2017. Now, this information only filtered down to us around February, March of 2016, and pilot sites were identified that were to go smoke-free by October 2016. So that gave us only around 8 months of preparation time. We work for one of the wards that was part of that pilot site. So the pilot sites were identified across the rehabilitation services, and on our site we also have CAMS and perinatal services as well. So that was for October 2016, and then the rest of the service went smoke-free in April of 2017. Now we did take a multidisciplinary approach towards creating the draft policy, also taking into account the opinions of the service users. Did a lot of meetings and interviews with them to get their thoughts on the whole process. So very brief sort of overview of what we did. The draft policy was created and that was piloted in our pilot sites. Was tweaked and adjusted somewhat before it was rolled out over the rest of the site in April 2017. Straight away we trained 602 staff with an e-learning module, so all patient-facing staff were trained to level 1 standard, and then some level 2 staff were identified. We trained 165 staff to level 2, so each unit had a number of level 2 trained staff as well. And there's still obviously ongoing training, as I'm sure there are everywhere. Now our support starts within 30 minutes of admission, so immediately that a new patient arrives to our unit, we offer them NRT and a referral to the Smoke Stop team. And throughout admission, they're offered free NRT and support from the level 2 advisors as well. And then ongoing support if they're discharged, we then link them in with Live Well Dorset, which is a service for the community.
Right, so here we go, the challenges, and I think this resonates with everybody here. We had a staff reluctance to challenge. We've got a lateness of the training and the resources. It was thrown on us so quickly, and when you compare it to the Maudsley, they had like a 2-year window, and a lot of resource went into that. This was just thrown onto us really quickly, so it was so if anything could come out of that, if you're not gone smoke free, get that resource in as quickly as possible. A lack of guidance, lack of funding, and a lot of uncertainty. The policy came out and it was seen to be an iron fist approach straight away. This has got to happen, off you go, it's over to you wards. That's what it felt like to everybody. So we looked at this and we thought we can't let this happen to us. We've got to preempt what's going to happen. So from the May, wasn't it, we started to develop the service. So if you can take that away, try to get it, even before they say start this date, get it in earlier, just start thinking, talking, engaging people straight away. The other challenge was the impact on the patients wasn't really considered. They were looking at it. Our medics are very difficult to engage into these systems, and trying to get them to come to meetings to say we are going to go smoke free is a real challenge, and it still is today. It was only this week that we managed to get Mary Yates. If you ever met Mary Yates from South London Northern Hospital, she's like the national guru for the smoking as well. And she came to us this week, and this is one of the things she was highlighting, that trusts need to start engaging the medics, and the medics need to really get involved in it. Because at the end of the day, they are prescribing the care and the treatments, etc., etc. So that's what we really need to look at. there was a heavy focus on NRT, and I'm sure we've heard it this morning in a lot of the meetings that a lot of the cupboards were just stuffed full of NRT products, just dish it out as and when, and that's what happened to our trust. And what we've discovered since is not many people engage with most of the NRT. So we are looking at different things at the moment, which I'll come on to very shortly. And the reluctance from the patients to engage was a big challenge, because we're a long stay locked rehab unit. One of the biggest problems we had was they've been smoking 30-40 years, and that's all they seem to do, and that was the attitude.
And actually, sorry to interrupt you, Colin, but we've seen percentages for the amount of people who smoke with a mental health compared to the general population. But actually, on our ward of 16 patients in the locked unit, 100% smoked. Every single one of our patients smoked when we went smoke free.
Yeah.
So
yeah, it was a big challenge.
Yeah, a huge challenge for us.
But looking trust-wide, that's just our local service, but trust-wide, they had a massive problem with our acute wards. We're quite a large trust. We've got a population coverage of 700,000. Haven't spoken to everybody yet in that 700,000 about smoking, but it's a massive area that we're covering, from Bridport all the way through to Christchurch and right up to Sherborne. So it's a huge triangle of area to cover, trying to get people to engage. The communication wasn't brilliant. These are the challenges, right? We do have our successes as well, but these are the challenges we face. Okay, so skipping through.
Were you given any extra budgets for activities and entertainment and stuff like that? Because I know Landon had a shitload.
No,
We had nothing.
Nothing at all.
Our therapies lead put some of our therapies budget towards buying fidgets and distractions and word searching, crossword books and pens, and we did like a bag for each patient, like a tote bag with, similar to what they presented on earlier. We did a tote bag but with activities and nuts and bolts and things. Initially it seemed to, initially it was like the novelty of it did, but it kind of wore off, and we're not really sure where most of that is now. So
yeah, it's very difficult. Yeah, it has been a challenge. But let's look on the bright side. There are positives. We combined our clinics